happening between the Commonwealth and the shall be the truth, the whole truth, and nothing but the truth. Sorry, have a seat.
Watch your step, please.
All right, good morning, sir.
Good morning.
If I may.
Yes, please.
Thank you. Good morning. Could you please state and spell your name for the record?
PJ Hussey, Hussey,
And your date of birth?
5/5/1963.
Where do you work?
Duxbury Fire Department,
And how long have you been a firefighter?
32 years.
Are you also a paramedic?
Yes.
What's the difference between an EMT and a paramedic?
Paramedic has advanced life-saving skills, intubation, and medicine we can use on the patients.
And is there a certain type of training that you have to have as a paramedic?
Yes, every 2 years.
And to first qualify as a paramedic, what do you have to do?
There's a paramedic class that you take, upwards of 2 years.
So you take that paramedic class. Is there a test you have to take at the end
A
of
state test, yep.
And once you pass that state test and become a paramedic, you have to do continuing education. Is that correct?
Yep.
Okay. And did you take that initial training, pass that initial test, and then pass all subsequent training to be a paramedic?
Yes.
And how long have you been a paramedic?
About 17 years.
What is your current role with the Duxbury Fire Department?
I'm a captain, which is considered a shift commander.
And in January of 2023, were you in that same role?
Yes.
What does a shift commander do?
Oversees the operations of the town as far as firefighting and medical services.
How many fire departments, or stations rather, how many stations does Duxbury Fire Department have?
Duxbury has 2.
Okay. And how far apart are they?
About 10 minutes apart.
And are they staffed differently from
Yes.
each other?
Yeah.
And how are they staffed?
At the central station, there's a captain and usually 3, and the other station, there's 2, just 2 firefighters.
And for Duxbury, are all the firefighters that work for Duxbury Fire Department also paramedics?
Not all. We have two EMTs.
Okay.
Yeah.
Now,
The rest are medics.
I'm sorry?
The rest are medics.
And when you say medics, you're talking about paramedics?
Yeah, sorry.
No, it's okay. So directing your attention to January 24th, 2023, were you working that day?
Yes.
And what shift were you working?
My own shift, my group, shift 1.
And what is shift 1?
It's just we have four shifts, and I'm just group 1, shift 1.
Is there a certain time that spans? Time of day?
No, 24-hour shifts, 8 o'clock in the morning to 8 o'clock the next morning.
Okay, so you were working 8 o'clock in the morning on January 24th?
Yes.
And your shift would end 8 o'clock in the morning on January 25th?
Correct.
And were you working in that capacity as a shift commander on the 24th?
Yes.
Now, do you recall a call coming in shortly after 6 p.m. Dispatching you to 47 Summer Street in Duxbury?
Yes.
And did you respond to that scene?
We did.
And how many vehicles and personnel responded?
My car, the shift commander car, ambulance 1, and engine number 2.
And what was the personnel in each of those vehicles? Not names necessarily, but how many people?
We put, usually it's 2 in the ambulance, but because of the severity of the call when it first came in, we put 3 people in the ambulance, a driver plus 2 medics in the ambulance, and then 2 firefighter medics in the engine from the other station.
Okay, so that would be 6 people in total?
6 total.
Okay.
Yeah.
And did you have anyone from the second station respond initially?
We all came at the same time. We all got dispatched at the same time.
So would that have been 6 people total from both stations or 6 people from the central station?
6 people total from both.
And when you arrived on scene, what did you see upon arrival?
There's a couple of police cruisers that were there already, just beat us in. And then we had to go up back to where the patient was located.
And when you refer to the patient that was out back, was that Lindsay Clancy?
Yes.
And did you head to the backyard?
Yes,
And did you see her on the ground?
I did.
And were you personally treating her, or was it the other paramedics that
The
were
other
doing it?
paramedics were treating her.
Okay.
Yep.
And what were you doing?
Just supervising the call, just make sure things are handled appropriately as a shift commander.
Showing you what's been marked as Exhibit 37. Do you see the area where you were in the backyard that night on the screen?
Yes.
If you wouldn't mind standing up and just pointing where you were.
The patient was crossing right here. I was over here in this area here.
And if the record reflects, you pointed to the patient being to the right of the metal window well, and you were standing to the left of the window well, is that correct?
Yeah, she was right below this window, so someplace she was right in this area.
Okay.
And I was just a little bit further over.
And when you said right below this window, you're pointing to the far right second story window?
Yep. Yep.
Merci.
Thank you.
At some point in time while you were standing there, did you hear a loud noise?
I heard a scream.
Okay. And when you heard the scream, could you tell where it was coming from?
It sounded like it was coming from the basement.
And did you look anywhere in particular?
Yeah, I was able to look through the basement window and able to see a male person downstairs.
And when you say the basement window, are you referring to that first
Yes.
Metal window
Yes.
well?
Yes.
That was in Exhibit 37. Just showing you, again on the screen here, what's been marked as Exhibit 50. This window here on the right, does that fairly represent the window that you looked through and could see down into that
Yes.
basement office?
Yeah.
And was the light on in the basement office when you looked in?
A light was on, yes.
And what did you see when you looked in the window?
After I heard the scream, I saw a older male gentleman, now knowing it was Patrick Clancy, unwrapping something from a child's head.
And when you saw the male unwrapping something, can you demonstrate the motion that they were doing?
Yeah, the child was on the ground. The head was towards the window, so the head was towards the back of the house, and he picked the child up, and he was in a circular motion, taking something off the head, around the neck.
And could you see the child's face?
Yes.
And what observations did you make of the child's face?
The head was blue.
And did you later learn that child was Dawson Clancy?
Yes.
At that point, what did you do?
Because of the severity of Miss Clancy on the ground, and now we have another patient, I put a all-call in, which is a recall of Duxbury personnel, all Duxbury personnel, if they're available, to come back to the town to help out for when I need help on the scene, and they also need help in the town to cover the town while I'm busy at this scene. And I also requested a mutual aid ambulance to respond to the scene.
Because at that time, there was only one ambulance that was responsible.
One ambulance for Miss Clancy, yes, and then I called another. Seeing the next patient, I called another ambulance in.
Okay, and what is mutual aid?
Mutual aid is it's a shared system that all the towns use. That if we get busy or busy with calls, we're able to call help in from surrounding towns to give us a hand, whether it be fire related or medical related.
Does Duxbury only have one ambulance?
We have three.
But you only had one staff that night?
Yes.
Okay, so you call in for an additional ambulance. At some point in time, do you learn that there are two other patients,
Yes.
Cora Clancy and Callan Clancy?
Yes.
At that point in time, do you have to do anything to call in more assistance?
Well, the recall for Duxbury personnel was already put in, so I called two more ambulances at that point.
And the scene that night, discovering another victim, was that a chaotic scene?
It turned very chaotic very quickly.
Okay.
Yeah.
And was it a situation where people would start treating a patient but then have to move on to something else and someone would take over?
Sort of. I had myself as a shift commander. I had an EMT with me, but there's also 4 paramedics. So the way it ended up working, all the initial paramedics were with Miss Clancy in the beginning, and then when we found the other patients, we left a paramedic with Miss Clancy, a paramedic with Dawson, and then the 2 paramedics were with the 2 other kids in the other room.
And did someone eventually also have to be with Patrick Clancy?
Eventually, yes. Yeah, but at the time, there was nobody with him in the beginning.
I have nothing further. Thank you.
Okay. All right, counsel?
No questions. Thank you, sir.
All right, thank you, sir.
Thank you.
Attorney Buckingham.
Your Honor, the Commonwealth would call Loring Nud as its next witness, please.
Same objection for the record.
All right.
Good morning. Do you solemnly swear that the testimony and the evidence you shall give to the court and the jury in the matter coming between the Commonwealth and the defendant shall be the truth, the whole truth, and nothing but the truth, so help you God? I do. Thank you, sir. You may have a seat.
Why don't you stop there, please?
All right, good morning, sir.
Good morning.
May I inquire?
Yes, please, counsel.
Thank you. Good morning.
Good morning.
Could you please tell the jurors your first and last name?
My first name is Loring, Loring. My last name is Nud, Nudd.
And do you have a nickname that you go by?
I do.
What's that?
Everybody knows me as Chuck.
Chuck. Do you work, sir?
I do.
What do you do for work?
So I'm a firefighter EMT with the Duxbury Fire Department. I was at that time. I am now retired.
Okay, so when did you retire?
So I retired a year ago.
A year ago? And so how long had you been working with Duxbury Fire before your retirement?
A little over 30 years.
30. And can you explain what your role was as a Duxbury firefighter?
So if I was an EMT, which 80% of our calls are probably that related. So I would assist a paramedic, or I would drive the ambulance, or whatever was necessary at the time. And then we were also did fire suppression, and we were all trained in that and went to the academy and all that.
Okay, and can you tell us what the difference is between an EMT and a paramedic?
So a paramedic requires another year or two of training, and they're able to prescribe meds. I mean, not prescribe meds, excuse me. Give meds that they have according to what they need to do. They can also read the monitor that shows rhythms in the heart and what have you.
Is it fair to say that as an EMT, you're trained in basic life-saving techniques,
Correct.
while a paramedic is advanced life-saving techniques?
Correct.
And so at Duxbury Fire Department, is it also fair to say that each and every firefighter has that dual role of either being an EMT, a paramedic, and a firefighter?
Yes, some are. There might be one EMT, just a basic, where most of them are the medics but we're all firefighters too.
Okay. And in the town of Duxbury, does the town itself have its own ambulances
Yes.
in addition to the fire engines?
Yes.
And there's also ladder trucks, correct?
Correct.
Now, when you were working as a Duxbury firefighter, what was the schedule? How did you work your shifts?
So we work 24-hour shifts.
And then how many days on and how many days off?
So we'd have 1 day on, 1 day off, 1 day on, and 5 off.
And a 24-hour shift, when did it start and end?
It was 8 o'clock in the morning to 8 o'clock the next morning.
So if I direct your attention to January 24th of 2023, you were still working for the Duxbury Fire Department then, correct?
Correct.
And were you on a 24-hour shift that day?
I was.
At some point during the day, were you given kind of what your assignment was for that shift?
Yes.
What was your assignment?
So that day, we all kind of float around a little bit, but we had a newer member that had made progress. He was an EMT and then made it to paramedic. So I was kind of what they called the backup guy. So I would do whatever fill-in needed to be done, and I would assist with them if necessary.
Okay, and so were you kind of assigned to the ambulance at the central station as that backup person?
I was.
And the person that you identified was kind of the newer employee. What was his name?
Paramedic Doherty.
And that would be Daniel Doherty?
Daniel Doherty, yeah.
And who was the other Duxbury firefighter that was assigned to the ambulance that shift?
It would have been paramedic Kevin Heath.
So at approximately 6 o'clock or just after 6 p.m., were you advised of a dispatch to a residence in the town of Duxbury?
Yes.
And where was that dispatch going to take you?
So it was going to take us to Summer Street.
And so you and firefighter Heath and firefighter Doherty, you all get in the ambulance,
Correct.
and do you go to 47 Summer Street?
We do.
Who was in the ambulance? Who was assigned as kind of the driver and the tech?
So at that time, because we had heard, what kind of call we had an idea of what call we were going to. The two medics sat up front and were able to converse while I sat in the back and again was that backup guy, more or less.
Okay. And as far as the nature of the call that you believed you were coming into, is it fair to say that the initial call had to deal with a female that had gone out the window, possibly a suicide?
Yeah, as I remember, it was a second floor fall.
At the time that you were dispatched to that location, did you know that there was any pediatric patients or children involved?
No.
Now, approximately how long did it take to get from the station, Central Station, to 47 Summer Street, if you recall?
I'm going to say 4 to 5 minutes.
And when you arrived on scene, were there already other emergency personnel on scene?
There were.
Were you the first ambulance on scene?
We were.
How about fire trucks? Were there any other fire trucks from Duxbury?
The fire truck, you could hear it in the background, but it wasn't there yet.
So is it fair to say that there were some Duxbury police cruisers that had arrived just ahead of you?
Correct.
Where did you go with the ambulance when you got to that address of 47 Summer Street?
So as we were pulling up, I could hear the two guys up front say, the cruisers are in the way of the driveway. So I said, okay, you guys take the call, meaning get out of the car and get out of the truck and get started, and I'll take care of the truck.
Okay. And so when you come to the address, are you able to at least pull into the driveway at some point?
Not at that point. Because I was in the back, I switched to the driver's seat. And at that time, I saw an officer coming and he was getting ready to move the vehicle that was in our way so that I could back in.
And so were you able to then back the ambulance into the driveway?
I was.
And were there other vehicles that were not emergency personnel vehicles in the driveway?
There might have been some of their vehicles, but there might have been, but I don't really. I had enough room to put my vehicle there, and that's all that mattered.
Okay, so when you backed the ambulance in, firefighter Heath and firefighter Doherty, what did they do?
They had already jumped out. Grabbed the gear, and taken off for the back of the house.
Once you got the ambulance secured in the driveway, what did you do?
So, assuming that they were going to need a stretcher, I started pulling a stretcher out of the back of the ambulance.
And again, you said you backed the ambulance in?
Correct.
As you were pulling the stretcher out of the back of the ambulance, did you observe somebody coming from the house?
Yes.
What did you see?
One of the police officers was carrying a child.
And so what did you do when you saw him carrying the child out of the house?
So at that point, the stretcher was almost out of the vehicle, and I said, over here, and he placed him on the stretcher.
Were you able to make observations of the child as he's being placed on the stretcher?
I was.
What did he look like?
So his face was blue. He had marks around his neck, and his body was pale.
And so once the officer, or first off, was the officer somebody you knew from Duxbury?
Correct. It was Officer Homestead.
Okay. And once the child was placed on the stretcher, what did you do after you made that initial observations of him?
So we rolled it right inside so he could start doing CPR.
Now, as an EMT, what is the first thing you generally do when you're observing a patient or assessing a patient?
So you always look for response and you go for airway.
Okay. And fair to say there's kind of what they call the ABCs.
Correct.
Can you tell the jurors what that means?
So it's airway, breathing, circulation.
Okay. And in this circumstance, were you able to observe the child breathing on his own?
No.
How about, were you able to secure an airway for him?
Not at that time. We were still doing the preliminary.
And how about circulation or pulse or cardiac activity? Were you able to determine any of that upon your initial assessment of him?
At that point, no.
Now, after you are in the back of the ambulance, do other EMTs or other paramedics come and assist you with this child?
Yes, so when the patient was getting rolled in, I also yelled out to my captain, hoping that he was going to hear me, that I needed a medic in my truck because I needed him to know that there was someone in my truck. And I'm assuming someone heard me, and they then directed a medic to my truck once one appeared.
Okay, and so the medic that came to the truck, was that Keith Netty?
Yes,
And that was not the original person who went to the scene with you in the ambulance, was it?
correct.
And what happened when you had the child in the back of the ambulance? What did you guys do to try to tend to him?
So we were doing CPR, and then there was he wanted to check the monitor, so we got the monitor out.
And with the monitor, what was the monitor supposed to be looking for?
Heart rhythm.
Okay. And so do you have to kind of hook that up to the patient in order to assess whether there's any activity?
Correct.
And those monitors that you have in your equipment, do they do anything more than just check for heart rate?
The paramedic can then look and see what kind of, not just a heart rate, but a rhythm. And then
If there is not a rhythm, does that machine help you to do anything to try to restart somebody's heart?
with a rhythm, with the rhythm that they gave us, they said we can disconnect it, because they were concerned they needed the monitor downstairs too, or elsewhere.
And is it fair to say that at that point you're assisting the paramedic with their assessment and running that equipment and checking the monitor?
No, I'll allow it, but let's kind of move on.
I'm sorry.
You know,
That's okay.
Re-ask that.
Are you assisting the paramedic at that point to treat the child in the ambulance? At some point, do you leave the ambulance?
I do.
And where do you go after you leave the ambulance?
I bring the monitor down to the basement.
Are the other paramedics and the other responders still working on the child?
Correct.
And to be when you in the basement.
Because my they said they needed equipment in the basement.
So when
There were.
were you to make observations of those children?
Not really. I mean, they weren't crying.
Okay. And fair to say they were being treated by others?
Correct.
And so once you dropped off that equipment, did you go back outside?
I did.
And what ultimately was your role at the end of this call? What were you asked to do?
I was asked to drive.
So the ambulance that responded from Duxbury, that's ambulance number 1?
Correct.
Ambulance 1. Did you drive that ambulance to a hospital?
Correct.
Which hospital was that?
I forget if it was the Jordan or the BI now, but it's the Plymouth Hospital.
Here in Plymouth?
Correct.
And that was with Dawson Clancy in the back, correct?
Correct.
No further questions, thank you.
All right.
Thank you.
Attorney Reddington?
No questions. Enjoy your retirement.
All right. Thank you, sir.
Thank you.
Attorney Buckingham?
Thank you. The Commonwealth would call Keith Netty as its next witness, please.
Same objection, Your Honor.
Good morning. Do you solemnly swear that the testimony and the evidence you shall give to the court and the jury in the matter now coming between the Commonwealth and the defendant impartially and truthfully? I do. Thank you, sir. You may have a seat.
Watch your step, please.
All right. Good morning, sir.
Good morning.
All right, counsel.
Thank you. Good morning.
Good morning.
Could you please tell the jurors your first and last name, please?
First name is Keith, last name is Netty, N-E-T-T-E.
And where do you work, sir?
I work for the Duxbury Fire Department.
How long have you been with the Duxbury Fire Department?
About 17 years.
And currently working for the Duxbury Fire Department, what is your role? What do you do there?
Right now I'm a captain and shift commander.
Okay. And are you a firefighter as well as a trained paramedic?
Yes.
At Duxbury Fire, you all work 24-hour shifts?
Correct.
If I draw your attention to January 24th, 2023, do you recall working a 24-hour shift that day?
I was at home.
Okay. And so what was the shift that you were working that week, if you remember?
I believe I worked maybe 2 days prior. I don't really remember.
Okay. So you were on a day off?
Yes, correct.
And how was it that you ended up being involved in the call at 47 Summer Street on January 24th?
We were recalled from via a pager and a text message that there was an incident going on and that we were to respond.
So can you explain to us how that works?
So a tone goes off through dispatch that sends off a pager at our houses that alerts us. Then we also get text messages about the incident and then respond either to the station or to the scene, whichever they request.
As a Duxbury firefighter, are part of your responsibilities to respond to these recalls?
Yes.
Is it a voluntary thing?
Yes.
So if you were indisposed or unavailable when a call went out or tone went out, would you be expected to respond to the scene?
No.
But in this case, on January 24th, just after 6 p.m., you heard that call go out, correct?
Correct.
And so then what did you do when you heard the call?
I drove to the scene in my personal truck.
When you got to the scene, what did you see?
I saw police and fire vehicles, and then I walked up the driveway and walked into the back of the ambulance.
Now, when you arrived and saw police, so that was Duxbury Police?
Correct.
And the fire personnel that was on scene, who was on scene, if you remember?
I only saw 2 people on scene initially. That was Kevin Heath and Sergeant Homestead.
Okay. And Sergeant Homestead is a Duxbury officer?
Correct.
Now, was there a Duxbury ambulance in the driveway when you pulled up?
Yes.
And before even getting past that ambulance, were you asked to assist?
Yes.
What did you see when you came to the back of that ambulance?
I saw an officer, Sergeant Homestead, and Kevin Heath doing CPR on a child.
Had you seen how the child ended up in the ambulance, or did you come after?
I came after.
Did you then help take over with treating that child in the back of the ambulance?
Yes.
What was your initial observation of the patient? What did he look like?
Blue, white, non-responsive, not breathing, no pulse.
And this particular patient, did you come to learn him to be the child named Dawson Clancy?
Yes.
And he was approximately 3 years old?
Yes.
What kind of treatment did you and the paramedic Heath offer to Dawson in the back of the ambulance? What did you do?
We tried to start an IV, but then we also started an IO, which is kind of like an IV. Tried intubation, which is an advanced airway, medications, and continued CPR.
So an IV, that's just putting a needle into somebody and trying to pump fluids in medicine, correct?
Correct.
Tell us what an IO is.
An IO is interosseous, which is basically into the bone marrow on the lower leg.
So what do you do to try to enter an IO?
Usually we have a drill, but we had a manual one instead.
So what do you do with the manual drill to enter the IO?
You just twist, and then it goes into the bone.
And what bone do you attempt to do this in? And were you able to enter that IO into Dawson?
Yes.
What is the purpose of the IO versus the IV?
If the patient has difficult access, which pediatrics do.
And in this circumstance, what kinds of medication were you trying to deliver through the IO to Dawson?
Epinephrine.
What's the purpose of epinephrine?
Basically kind of helps to restart the heart.
And at this point, he had no heart activity.
Correct.
You also mentioned attempts to intubate. Can you tell us what that means?
So intubation is an advanced airway where you put a tube into the airway to secure it to deliver high flow oxygen.
Were you able to intubate Dawson?
Yes, Kevin Heath did.
And what do you do when you enter the tool to intubate?
You go into the mouth and you do a motion of pulling up to see the vocal cords so you can pass the tube through.
And what do you attach to the tube to try to increase the breath?
Oxygen and BVM, which is basically you're squeezing a bag.
So BVM would stand for bag valve mask?
Correct.
While you were treating Dawson and doing the airway, intubating him, giving him the medicines, were you able to observe anything about the area of his neck?
Yes.
What did you observe about his neck?
Dark red marks around his neck.
Now, all of this is happening while you are in the back of the ambulance with firefighter Heath, correct?
Correct.
And do you recall another Duxbury officer being present, Dan Doherty?
Yes.
Eventually, was that ambulance then sent to the local hospital?
Yes.
Which hospital did you guys go to?
BI Plymouth.
On the ride to the hospital, did you ever get a pulse for Dawson?
No.
Were you ever able to resume breathing using that method with the bag valve mask?
No.
The efforts to give him the medication, the epinephrine, did it ever do anything to start his heart?
No.
When you arrived at the Beth Israel Hospital emergency department, tell us how you transferred the care of the patient.
We wheeled the stretcher in. We went into the first room, which is trauma 1 and trauma 2. We moved the patient over to their bed and then transferred care.
While you were at the emergency department at Beth Israel, did you see another child from that same home come in?
I did.
And what department brought them in? What fire department?
Marshfield.
Did you do anything to assist Marshfield when they came through the emergency department?
I assisted in compressions when they were getting the child out of the ambulance.
And is that something that is ongoing during when you're trying to transfer care to the emergency staff?
Yes.
Being the father of the children at the emergency department that evening when you were there?
I did.
And you came to Patrick Clancy?
Correct.
Observation of him at the
Sad. And yeah, just basically visually upset.
Did you do anything yourself to assist him when he was there?
I assisted to get a chair in case he needed to sit down.
And was that before or after the children had been declared?
I believe it was after.
Thank you.
All right. Attorney Reddington?
I have no questions. Thank you, sir.
All right, thank you, sir. You may step down. Thank you.
The Commonwealth would call Patrick Dwire as its next witness.
Same objection for the record.
Okay.
Do you solemnly swear that the testimony in the evidence you take a seat, sir.
All right, good morning, sir.
Morning.
All right. Yes, counsel.
Thank you. Good morning.
Morning.
Could you please tell the jury your first and last name?
Patrick Dwire,
Can you please spell your last name for the record?
D-W-Y-E-R.
And how are you employed, sir?
I'm a firefighter paramedic at the Duxbury Fire Department.
And in what capacity are you a firefighter or paramedic? Do you have any supervisory roles?
No, I'm not a supervisor at the department.
Now, in your role as a firefighter and a paramedic, did you receive training for those roles?
Yes.
And how long have you worked for the Duxbury Fire Department?
It's in my 8th year right now.
I'm going to draw your attention to January 24th of 2023. Do you recall working that day?
Yes.
Were you on a 24-hour shift?
Yes.
And so that would be an 8 a.m. to 8 a.m., correct?
Correct.
At approximately 6 o'clock or just after 6 p.m., were you dispatched to 47 Summer Street?
Yes.
What was your assignment that day on shift?
I was working on the engine out of our Station 2
Where is Station 2 located in the town of Duxbury?
on Franklin Street.
When the dispatch came into 47 Summer Street, do you know approximately how long it took you to get from Station 2 to the location?
A few minutes.
Who was working with you at Station 2 that day?
Jennifer Stratton.
What were each of your designated roles?
I believe Jen was driving the engine, and I was in the officer's seat.
Now, at Station 2 in Duxbury, is it normal for just two of you to be on shift at that station at any given time?
Yes, correct.
And fair to say there are other firefighters and paramedics that are on staff at the central station, correct?
Correct.
And in this dispatch, you at Station 2 on the engine were dispatched to 47 Summer Street, correct?
That's correct.
When you received the dispatch, did you have any information that there had been children involved?
No, we did not.
When you got to the scene, what did you see?
When we got there, it was dark out. We started walking towards the house, and the other firefighters were there before us. Then we were directed to go to the basement.
Before going to the basement, were you directed towards the outside of the house and then redirected to the basement?
We were walking towards the backyard, so I believe that's where the first person was located. So we were kind of making our way back there.
So I'm just going to show you what's been previously marked as exhibit number 34. Can you see it on the screen next to you?
Yes.
And so would this be 47 Summer Street?
Yes.
And fair to say you were on your way to the backyard on the left side when you were redirected?
Yes.
Did you ever make it into the backyard?
We went through the backyard to go into the residence.
Okay. But you were directed to the basement to testify?
Yes.
If you could take a look at that screen again, I'm going to show you what's been marked as exhibit 38. Can you see over here sliding glass doors?
Yes.
Is that where you entered the house?
Yes.
You indicated that you also went to the basement, correct?
Correct.
When you got into the house and went down into the basement, which side did you go to at the bottom of the stairs, the right or the left?
We went down to the left.
What did you observe when you went down into the basement?
We saw 2 children on the ground and the father sitting on the couch next to them.
So again, just going to show you what's been previously marked as exhibit 95. Is that fair to be the left side
Yes.
basement? And exhibit 96. Where did you see the father?
He was sitting on a couch or something in the area. Not sure exactly which one.
Did you also observe the children on the floor?
Yes.
How many children?
2.
What did you do when you observed the children?
We started CPR. They were in cardiac arrest.
Okay, and so which child did you work on?
The 5-year-old girl
Okay. Where was she located?
on the floor in that room.
So as far as looking at exhibit number 96, does that depict the general area where you saw the 5-year-old child?
Yes.
Where did you treat her? Where did you see her?
Right in that area. I can't remember exactly where it was.
Okay. In this photograph of exhibit number 96, do you see a lot of equipment?
Yes.
And I'm just going to show you Exhibit 101 too, with some more equipment. Do you see all that equipment there?
Yes.
Is that equipment that was used to treat the 5-year-old child?
Yes.
Did you learn her name to later be Cora Clancy?
Yes.
While you were assisting or working with Cora, what was Jen Stratton doing, your partner?
She was with the other child.
Do you recall where the other child was in relation to Cora?
They're kind of right next to each other.
So again, showing you exhibit number 96, if you look to the middle of the photograph, there's a red spot on the floor. Is that a fair place where Cora was?
Yes.
And would the other child, the younger infant, was he closer to the couch or the bed area, or was he in a different location in the basement?
Probably more towards this side, I would say, if I could remember.
When you say this side,
Like
what do you see in the picture to depict where?
probably closer to the cardiac monitor.
Okay, and can you tell us which is the cardiac monitor? Is it here at the bottom?
Yes, that piece of equipment right there.
And again, in exhibit 101, can you see the cardiac monitor a little better?
Yes.
Where is it in this photograph?
Right there.
Do you mind just getting up and pointing to it on the screen? So we're talking about this black bag that is sort of off-center of the photograph next to a blue bag. Is that fair? Is that?
Sorry, what was the question?
I'm just trying to locate it on the picture for the record. So you pointed to a black bag that's kind of off-center in this photograph, correct?
This is a cardiac monitor.
Okay, thank you. When you started to treat Cora, what were your observations of her when you came upon her?
I noticed she kind of looked like she had some burst blood vessels around her eyes.
Did you make any observations of the color of her skin?
It was kind of pale, bluish.
When you approach the patient, what's the first thing that you do to assess them?
I check for breathing, check for a pulse.
Did she have a pulse?
No,
Was she breathing?
no.
And when you're doing those things, are you able to make observations of the area around their face, like their nose and their mouth?
Yes.
In this circumstance with Cora, did you notice anything around her mouth?
Around her mouth? Not that I can recall.
When you are trying to assess her breathing, is there anything you do to try to resuscitate somebody or get them to breathe?
Yes, we would use a bag valve mask to help them breathe.
Did you do that for Cora?
Eventually, when we got the equipment down there, yes.
And were you able to use that device and get her to breathe on her own?
No.
And while you're utilizing that bag valve mask, fair to say you're in close contact and making observations of the patient's face and mouth, correct?
Yes.
And you indicated that you're not sure if you recalled seeing anything around her mouth?
Nothing particularly that I can think of.
Okay, if I may approach.
Yeah.
Just going to show you page 9, and if you could read like 17 through 19 to yourself. Does that refresh your memory?
Yes.
What did you observe in or around Cora's mouth?
That she did have some blood in her mouth.
Did eventually other emergency staff come down and help you with rendering aid on Cora?
Yes.
And fair to say one of the things that you do is maintain compressions and CPR.
Yes.
And can you do that by yourself, or do you often have to have somebody help?
Well, we usually have multiple people working.
And in this circumstance, with the treatment of Cora, other people came in and helped you with those things?
Yes.
Were you eventually able to prepare her to leave the basement area?
Yes, once we get more first responders down there.
And fair to say there was first responders from other departments that came and helped prepare to bring Cora out of the basement, correct?
Yes.
Do you recall how she left the basement?
We took her out of the basement on a backboard up the bulkhead stairs.
And the firefighters that were assisting putting her on the backboard, do you remember where they were from, what town?
Marshfield.
When Cora was placed into an ambulance, do you remember what ambulance she was placed into?
Marshfield ambulance.
Did you continue to help assist them when she was put in the ambulance?
Yes, I went to the hospital with them.
And do you remember who the firefighters were that were from Marshfield that were helping you?
Yes, Andrew Wilkins, Ryan Henry, and Kerry Carver.
And fair to say Andrew and Ryan were in the back of the ambulance with you, correct?
Yes.
And Kerry was driving?
I believe she was in the back also.
Okay. At some point, somebody hopped in the front seat and drove?
Yes.
And when you got to the hospital, which hospital did you transport to?
Beth Israel, Plymouth.
Were efforts continued to be made in that transport from Duxbury to Beth Israel and Plymouth?
Yes.
While inside of the ambulance, did you try to use one of those cardiac machines to shock or defibrillate Cora?
Yes.
Was there any result for that?
We shocked once but did not regain pulses.
And when you got to the hospital, did you transfer care to the emergency staff at Beth Israel?
Yes.
And did you do anything further on the care and treatment of Cora?
Not once we transferred care, no.
Nothing further.
Mr. Reddington?
I have no questions. Thank you, sir.
All right, thank you, sir. You may step down. Thank you.
Thanks.